Lark Silent Alarm and In-Home Sleep Studies. Roopal Patel, MHA 601, Principles of Healthcare Administration, Dr. Lashandra Span, due July 15, 2019. Disruptive sleep patterns affect many people, and these patterns have been found to have negative effects such as reducing the quality of life, increased mortality, and can exacerbate chronic conditions such as COPD. For this reason, healthcare organizations have created specific treatment facilities that follow the sleep patterns of patients and then offer diagnosis and treatment. They are generally known as sleep labs. Patients come at night, are hooked up to monitors and videos, and have sleep studies that span over multiple visits. Another option in diagnosing how sleep is affecting a patient's health are wireless monitoring devices worn at home. Patients are given guidance on how and when to use at home, and the sleep patterns are monitored and then downloaded to the patient's phone. One such device that made Entrepreneur Magazine's 2012 list for innovative healthcare business solutions is Lark Technologies' Silent Alarm. While the original version is now discontinued, when it was released in 2011, it garnered acclaim because it performed the same functions as a sleep lab, but patients were able to have sleep pattern analysis in the comfort of their own homes. A wristwatch is worn which tracks internal sleep rhythms, provides sleep coaching, and keeps all data in one repository. This shift from facility to home exemplifies disruptive innovation, as it took what might normally be considered a cumbersome process for patients and simplified it. The product also eliminated wages allocated for skilled labor to monitor the patient and allowed the use of much less costly options. Removing the sleep disorder testing process from the medical facility does pose some risks to the patient and the organization. A risk to the patient is dangerous sleep patterns cannot be identified in real time because the nightly summaries are not sent to the physician until the morning. This can cause a delay in necessary treatment. There is a financial risk with the loss of testing revenue for patients who now meet the criteria for at-home monitoring. Organizations will also have to account for ongoing loss or unreturned monitors. This can result in having to allocate extra financial resources to replace these devices. Finally, technology is constantly evolving, so organizations have to be prepared to purchase newer, more efficient devices on a regular basis, especially if the upgrades being offered will optimize patient care. Again, we see the need for allocating funds for these purchases. While there may be some options to sell the older devices for recycling, the organization would likely be making pennies on the dollar, so it would not offset new device purchases. But the reason the Silent Alarm made Entrepreneur's list is because the benefits outweigh the risk. From a patient and diagnosis standpoint, wireless monitoring at home provides more genuine patterns because the patient is within the comfort of their own home. The stress of driving late night to a facility, being in a strange environment with monitors attached and not knowing the strangers on the other side of the door could alter the sleep pattern that a patient might have. The sleep patterns at home can be done on a continual basis for a specific length of time and take into account variances between their weekday and weekend sleep patterns, which in turn means there are more accurate results, and that allows the physicians to have a more accurate assessment to formulate a diagnosis and treatment plan. There are also cost-saving elements, such as facilities reducing payroll and the cost of in-home monitors being less expensive than laboratory devices. With less critical patients doing at-home studies, sleep labs can reduce staffing and cut payroll. At the same time, the money spent on studies at home will be less since the devices themselves cost less. Finally, a positive impact on patient care will result as sleep lab staff can focus on high-risk and time-sensitive patients. Normal slots for less urgent patients now will be available, therefore patient care is optimized because patients' needs are prioritized, but not at the sake of the less critical because they are being monitored at home. The Lark Silent Alarm has found a niche with organizations that conduct sleep studies because it addresses the need to diagnose disruptive sleep patterns that have negative effects on patients and addresses the overhead and payroll burdens that organizations have. It has alleviated the need for in-lab studies for non-critical patients. An example of a major health organization using in-home monitoring is the Cleveland Clinic in Ohio. They use in-home wireless monitoring for patients and find the results aid physicians in formulating a diagnosis. Overall, the Lark Silent Alarm and similar products, which have come on the market since, have found a place in treating patients and have changed the way sleep labs historically function.